Chicago, a metropolis celebrated for its towering skyscrapers and vibrant cultural scene, found itself grappling with an unprecedented environmental crisis. On a seemingly ordinary day, the air quality plummeted, casting a pall of fear and uncertainty over the city. Reports of hazardous air pollution levels spread like wildfire, prompting widespread concern among its residents. The situation unfolded rapidly, leaving many scrambling for information and reassurance. As the sun rose, an unsettling haze blanketed the city's iconic skyline, a stark visual reminder of the invisible threat lurking in the air. What began as whispers of concern quickly escalated into a full-blown public health emergency as authorities grappled with the magnitude of the situation. Hospitals reported a surge in patients experiencing respiratory distress, their emergency rooms overwhelmed with cases linked to the deteriorating air quality. The most vulnerable members of society, the elderly and those with pre-existing respiratory conditions, bore the brunt of the crisis. As the hours passed, the gravity of the situation became increasingly apparent. The city found itself at a standstill, its bustling streets eerily deserted as residents heeded warnings to stay indoors. The air, once a source of life, had transformed into a silent, invisible menace, threatening the health and well-being of millions. Fear and anxiety gripped the city as news of the hazardous air quality spread. Residents, accustomed to the hustle and bustle of urban life, found themselves confined to their homes, their daily routines disrupted by an invisible threat. The usually vibrant streets of Chicago fell silent, replaced by an uneasy stillness. Social media platforms became echo chambers of concern and speculation. Frantic residents shared updates, seeking information and reassurance amidst the chaos. The hashtag #ChicagoAirCrisis quickly gained traction, becoming a digital testament to the collective anxiety gripping the city. The uncertainty surrounding the situation only served to amplify the fear. Conflicting reports from various sources added to the confusion, leaving residents unsure of whom or what to believe. Rumors and speculation ran rampant, further fueling the sense of unease that had settled over the city. As the hours turned into days, the city held its breath, united in its vulnerability and its desperate hope for a swift resolution to the unfolding crisis. The air quality emergency had not only impacted the physical health of its residents, but had also cast a shadow of uncertainty over the very fabric of their lives. At the heart of the crisis lay a chilling number 500. This figure represented the Air Quality Index, or AQI, reading, a metric used to quantify the level of pollutants in the air. An AQI of 500 signified the highest possible level of air pollution, categorized as hazardous to human health. To put this number into perspective, an AQI reading between 0 and 50 is considered good, while readings above 300 are deemed extremely rare and dangerous. The fact that Chicago's AQI had soared to an unprecedented 500 sent shockwaves through the city and beyond. This alarming reading meant that the air residents were breathing was saturated with a dangerous cocktail of pollutants, including particulate matter, ground-level ozone, and other harmful gases. Prolonged exposure to such high levels of pollution could lead to a range of severe health problems, from respiratory distress and cardiovascular issues to long-term damage to vital organs. The AQI of 500 was a stark reminder of the fragility of the environment and the potential consequences of neglecting its well-being. It served as a wake-up call, urging immediate action to address the root causes of the crisis and prevent such a catastrophic event from recurring. Adding to the fear and uncertainty was a wave of conflicting information regarding the air quality readings. While official sources, including the Environmental Protection Agency, or EPA, reported hazardous levels of pollution, discrepancies emerged from other sources, sowing seeds of doubt and confusion among the public. Google Maps, a widely used navigation app, displayed significantly lower AQI readings, contradicting the official reports. Similarly, some Apple devices indicated moderate air quality levels, further muddying the waters and making it difficult for residents to discern the true extent of the crisis. This disparity in information created a sense of distrust and skepticism among the public. Many questioned the accuracy of the official reports, while others accused tech giants like Google of downplaying the severity of the situation. The lack of a clear and consistent narrative only heightened the sense of anxiety and made it challenging for residents to make informed decisions about their health and safety. The conflicting reports underscored the importance of relying on credible sources of information during such emergencies. It also highlighted the need for greater transparency and coordination among government agencies, tech companies, and other stakeholders to ensure the dissemination of accurate and timely information to the public. Section 5. What are people saying? Social media became a battleground of opinions, speculations, and anxieties. Residents shared experiences, vented frustrations, and sought answers. The hashtag #ChicagoAirCrisis reflected the collective sentiment of a city on edge. Many expressed fear and uncertainty, sharing stories of respiratory problems. Others voiced anger, questioning the government's response and demanding accountability. Amidst the negativity, glimmers of hope and resilience emerged. Section 6. Expert Opinions, Seeking Clarity in Chaos. As the city grappled with the air quality crisis, experts in the fields of environmental science and public health emerged as voices of reason and authority. Their insights provided crucial context for understanding the situation and offered guidance on mitigating the risks posed by the hazardous air pollution. Dr. Vin Gupta, a renowned pulmonologist and critical care physician, emphasized the severity of the situation, stating that an AQI of 500 is practically unheard of in a modern city. This is a serious public health emergency that demands immediate attention. He stressed the importance of staying indoors, using air purifiers, and seeking medical attention if experiencing any respiratory distress. Dr. Juanita Mora, an allergist and immunologist, highlighted the vulnerability of certain populations, such as children, the elderly, and those with pre-existing respiratory conditions. She emphasized the need for these individuals to take extra precautions and seek medical advice promptly if they experience any symptoms. Experts also weighed in on the conflicting air quality reports, urging the public to rely on official sources like the EPA while acknowledging the limitations of data collection and reporting. They emphasized the need for greater transparency and coordination among various stakeholders to ensure the accuracy and consistency of information disseminated to the public. Section 7. Whispers of the Past, Chicago's Air Quality Legacy. Chicago's air quality crisis shocked many, highlighting the city's long struggle with pollution. Once called the City of Smoke, Chicago has made strides in improving air quality. Yet challenges remain, and the crisis showed the city's vulnerability. Regulations and technology have improved air quality, but vigilance is needed. Continued investment in clean energy and sustainable transportation is essential for a healthier future. Section 8. Protecting Yourself, a Guide to Survival. In the face of the hazardous air quality, protecting oneself and loved ones became paramount. Health officials issued guidelines and recommendations to help residents navigate the crisis and minimize their exposure to the harmful pollutants. Staying informed, taking preventive measures, and seeking medical attention when necessary emerged as crucial survival strategies. The most critical advice was to stay indoors as much as possible, especially for vulnerable individuals such as children, the elderly, and those with respiratory conditions. Keeping windows and doors closed and using air purifiers with HEPA filters could significantly improve indoor air quality. Venturing outside, if unavoidable, should be limited and done with caution. Wearing an N95 mask, which filters out a high percentage of airborne particles, could provide some protection. Strenuous outdoor activities should be avoided altogether to minimize inhalation of polluted air. Staying hydrated was also crucial, as dehydration could exacerbate respiratory problems. Drinking plenty of water and avoiding sugary drinks could help maintain bodily fluids and support overall health during the crisis. Monitoring for symptoms such as coughing, wheezing, shortness of breath, and chest tightness was essential. If experiencing any of these symptoms, seeking medical attention promptly was crucial. Early intervention could make a significant difference in preventing complications and ensuring a swift recovery. Section 9. A City Holding Its Breath. As days turned into nights, Chicago found itself in a state of suspended animation. The usual vibrancy of the city was replaced by an eerie stillness. The air had become a threat, forcing people to question every breath. The air quality crisis exposed the fragility of urban life. It united the city in a shared experience of vulnerability and resilience. As the days passed, there were glimmers of hope. The AQI readings began to decline, a testament to the efforts being made. The The sense of panic began to subside, replaced by cautious optimism. The experience left an indelible mark on the city and its people. The crisis served as a catalyst for change, prompting a renewed commitment to protecting the air